Welcome to another guideline summary by PAC-U. The Global Initiative for Asthma, or GINA, periodically updates its guidelines for asthma management and prevention. The latest 2023 update provides new recommendations based on recent evidence. The goal of the GINA guidelines is to provide clinicians with an evidence-based framework to optimize asthma control and reduce risk in their patients. Preventing exacerbations and minimizing medication side effects are key priorities. These guidelines are developed by an international panel of experts who systematically review and evaluate the latest asthma research. Recommendations are graded based on the strength of supporting evidence. The 2023 GINA report provides expanded guidance on biological therapies like anti-IgE and anti-IL-5 antibodies for severe asthma patients. It introduces a revised stepwise approach for medication adjustments that emphasizes symptom control and exacerbation risk reduction. There is greater emphasis on inhaler technique education using physical demonstration and clear instructions. The guidelines also discuss emerging research on asthma endotypes, distinct subtypes based on biology and clinical features. This ties into personalized medicine, using biomarkers and genetics to predict responses to targeted treatments. Other updates include revised sections on comorbidities like obesity and smoking, updated treatment flowcharts, and new evidence on medication safety. Asthma is a heterogeneous disease characterized by chronic airway inflammation. It's defined by a history of symptoms like wheeze, shortness of breath, chest tightness, and cough that vary over time and in intensity, together with variable expiratory airflow limitation. Asthma assessment includes a detailed history, physical exam, and objective tests like spirometry and bronchial provocation tests. Assessment aims to confirm the diagnosis, identify contributing factors, symptom severity and exacerbation risk, and guide treatment options. Asthma treatment should be tailored to each patient's individual needs and preferences, with the goal of controlling symptoms and reducing risk of exacerbations. This patient-centered approach considers the patient's phenotype, medication access, goals, and values. For adults and teens, the foundation of asthma treatment is a short-acting bronchodilator inhaler, used as needed to rapidly relieve any breakthrough symptoms like coughing, wheezing, or chest tightness. These quick-relief medications provide immediate airway opening. When asthma symptoms occur more than twice per month, daily long-term control therapy is recommended. Low-dose inhaled corticosteroids reduce inflammation and swelling in the airways to help prevent symptoms from starting. Patients also continue carrying their fast-acting inhaler for any sudden worsening. If asthma is still not well controlled with weekly persistent symptoms or nighttime awakenings, a long-acting bronchodilator is added to the anti-inflammatory corticosteroid in a combination inhaler. The long-acting drug keeps airways open around the clock, while the corticosteroid treats the underlying inflammation. For those with daily asthma symptoms or exacerbations despite these inhaled medications, treatment is stepped up to a medium-dose corticosteroid long-acting bronchodilator combination. This higher-intensity treatment aims to gain better control. Finally, for severe asthma with symptoms continuing despite these therapies, specialists can consider advanced add-on treatments like targeted biologics or oral corticosteroids. These strongest medications are reserved for when inhaled options alone are inadequate. For children with asthma ages 6 to 11, the GINA guidelines outline a 6-step approach to medications based on level of symptom control and risk of exacerbations. In Step 1, for those with symptoms less than twice a month, only as needed short-acting bronchodilator relief medication is recommended for infrequent flares. In Step 2, daily low-dose inhaled corticosteroids are initiated for those with symptoms more than twice a month to prevent exacerbations. Children continue carrying fast-acting relief medication for any breakthrough symptoms. Step 3 adds in a long-acting bronchodilator to the daily corticosteroid for those with asthma symptoms most days of the week or waking at night once a month or more due to asthma. This helps keep airways open. In Step 4, the corticosteroid dose is increased to medium dose for those with persistent daily symptoms or waking once a week or more. This steps up the anti-inflammatory effect. Step 5 involves referral to a specialist for consideration of add-on treatment like a biologic therapy when control with Step 4 treatment is inadequate. GINA recommends providing personalized asthma education to teach patients self-monitoring skills for tracking symptoms and peak flow. Instruction on inhaler and device technique is key, using physical demonstration and clear instructions. Patients should receive a written personalized action plan for recognizing and responding to worsening symptoms. The goal is to empower patients to actively manage their disease. Asthma often co-occurs with other diseases like chronic rhinosinusitis, obesity, gastroesophageal reflux disease, and obstructive sleep apnea. These can worsen asthma control. Mental health disorders are also more common in asthma patients. Comorbidities should be actively diagnosed and treated. In elderly patients, polypharmacy risks must be considered. Cardiovascular disease can restrict beta agonist options. Osteoporosis management is important in those on oral corticosteroids. Adjustments tailored to the patient's multimorbidities are key for optimal asthma management. Patients with persistent symptoms or exacerbations despite optimized therapy may have difficult to treat or severe asthma requiring referral to a specialist. Further phenotyping can identify the type of inflammation and guide targeted biologic therapy. Other options include bronchial thermoplasty to reduce airway smooth muscle, intravenous immunoglobulin for exacerbations, and managing comorbidities. Ongoing reevaluation for modifiable factors is critical in this group. Section 2 covers asthma management specifically in children under 6 years old. Key differences in this young population will be discussed in a separate video. Section 3 provides guidance on translating GINA's evidence-based asthma recommendations into clinical practice globally. It discusses establishing national asthma programs, training health professionals on guidelines, ensuring medication access, providing patient education resources, and utilizing digital health technologies. Successful implementation requires adapting strategies to local contexts and resources. The focus is on integrating effective asthma management into real-world health systems and workflows through training, access, and delivery mechanisms. In summary, the GINA report provides a comprehensive evidence-based guide for optimizing asthma control through an individualized, stepwise approach to medications, education, and self-management strategies. By outlining effective implementation into clinical practice, GINA promotes improved outcomes for asthma patients globally. For more concise guideline summaries like this, be sure to visit our website and follow our social media pages.